Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of my clients. And the question in the last episode was, my dad is having a DVT and he's now on a heparin infusion. Will he need an IVC filter? You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Andrea, who has her 34-year-old sister in intensive care with non-hodgkins lymphoma and a stroke. So the question this week is, my 34-year-old sister is in ICU with cancer and she had a stroke. She's not waking up. Help. So Andrea writes, Hi Patrick. My sister, who's only 34 years old, has been sedated 4 days after suffering a stroke, and she also has stage 4 aggressive non-hodgkins lymphoma, which is refractory cancer. She's had chemo, radiation, stem cell transplant, and nothing has worked to cure her. The doctors did a brain CT scan today, and they could see more than one stroke has occurred since she has been in ICU. She hasn't woken up after 3 days of the sedation. The doctors are saying it's up to the family to either take off the machines and let her die naturally, or we can continue treating her. The head doctor of the ICU says it's possible that she will wake up. We certainly won't give up on our sister or daughter and have given the orders to continue treatment and treating her and hope to the powers above she wakes up. They don't know what caused the stroke and the impact on her body. For now, I have the following really important questions. Number 1, have you had a similar situation in your experience? Number 2, do you have any suggestions on how to deal with the ICU team? Number 3, any advice on how to manage the situation in general? Number 4, what has worked well in similar situations from your experience? Thank you so much. I look forward to speaking to you tomorrow. From Andrea. So here is my response. And that response is after I had a lengthy phone consultation with Andrea and I summarized it all in an email. So here is the summary. Hi Andrea, it was very nice to talk to you this morning. Thank you for being a client. I really appreciate it. You and your family are facing a major challenge, but as we discussed, I think staying positive is the best option, even though it will feel hard at times. Here are some questions that you may want to bring up with the ICU team. Was your sister on propofol or on midazolam for sedation? Also, was your sister or is she still on morphine or fentanyl for pain relief? Depending on which drugs she had or still has, it may further delay waking up, as for example, propofol is short-acting and midazolam is long-acting. Especially with the liver being compromised, as you have shared with me, there may be a delay in the drugs being metabolized and therefore a further delay in waking up. I have put a link towards more information about sedation in general on our website, and you can find it on the link below this video. Also, as far as the seizures are concerned, she may have had last week, they most likely have started her on a drug called Keppra or phenytoin. Both are anticonvulsive medications and both are given to prevent seizures. Those drugs also come with significant side effects, including but not limited to further slowing down waking up. There is also a very high chance that with the sepsis your sister is currently battling and a potentially low hemoglobin are the red blood cells, she is needing inotropes or vasopressors such as noradrenaline or adrenaline. The inotropes or vasopressors, as well as the ventilator and the breathing tube or endotracheal tube, are considered major forms of life support. Without it, your sister most likely couldn't stay alive. Your sister will most likely need some calf compressors instead of anticoagulation medicine because of the low platelet count. The calf compressors will massage the calf and keep the blood flowing to prevent blood clots. Also, if I was you, I would ask the neurologist why she didn't have a CT scan of the brain after her first stroke. A delay of 3 days seems highly inappropriate to me. As discussed in the phone call, we should speak to the doctors because I speak the medical language and I can help you quickly in asking all the right questions. It often helps tremendously if families have an advocate involved. So here are, and then next is I transcribed another phone call between Andrea and myself below this video. So if you're watching this on YouTube, you can just click on the link below this video. That'll get you to our website where you can read the consulting session with Andrea and myself. And you can get other access. You can get access to other free resources and free questions answered on our website as well. So click on the link below this video if you are watching this on YouTube, or if you are watching this on our website, just scroll down and read the rest of the dialogue between Andrea and myself from another consulting session. Thank you. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, and via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.